Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today, I'm here with family physician and health system strategist, Dr. Dominic Novak. He's counseled a lot of businesses and families on the return to work and school this fall and how we can best navigate through it. So thank you so much for being here.
Tamara, it's my pleasure.
So can I call you Dominic or what do you prefer?
Call me Dominic.
Dominic? Okay, perfect. So here we are. It's, we're nearing the end of 2020 and we're getting ready. Are we in flu season or are we just entering it now?
Yeah, I mean, we're in two things. So what I would say we'd call it a twindemic, right? So we're starting up again with a new wave of COVID. So that's one wave. And then the second wave that we're actually anticipating is kind of our regular flu season as well.
So how do you know, let's pretend there is no COVID right now and it's just a regular flu season. How do doctors know what's coming in the way of the flu?
Yeah, it's a really great question because it's actually something that's informs and tailors our flu shots for every single year. So every year, we make sure to see what kind of flu is circulating throughout the world. We make sure to check what's in the swabs that we do with people when we're doing flu tests. And then based on that, then informs what goes into our vaccine. So the vaccine every year is kind of like a custom tailored cocktail of the most common or most dangerous flu viruses that are circulating during that year.
So when, sometimes I hear people say, oh, I don't get the flu shot. They never know what flu is coming and they're just taking a guess and they have no idea. I mean, you're not guessing, are you?
You're right in that it's an educated guess, right? And it's a guess based on epidemiology, and a lot of data and a lot of thought and a lot of science goes into it. And it's really the end goal is to protect us and protect our communities, right? Because we know that flu does kill a lot of people. It does hospitalize a lot of people, and even healthy adults, healthy kiddos. I've seen a lot of very sick people from the flu. And the reality is that, it's one of the things we can control in COVID. A lot of things are outside of our control. And because it's one of the things that we do have, that we have a lot of science for, that we can control, it's so important this year to get the flu shot. So I think that healthcare workers especially are very good around the flu shot. We get it regularly because we see the risks of what could become very bad flu in people.
So here we are in a worldwide pandemic with COVID-19. We have flu season. We're approaching it, quickly. How are we going to, what as responsible citizens and in doing what we need to do to protect ourselves and the people around us, what are some steps we can do as we head into fall and winter?
Yeah. And a lot of these steps we'd have heard of already, right? Because at the end of the day, the bad news is that we have this double wave coming up, the regular flu wave, and then on top of that, the COVID wave, the second wave for Canada, with rising case numbers, and in many places, higher case rates than we even saw in our first wave, and probably a long winter ahead. That's the bad news. And that's something that we're anticipating. The good news is that we already have, 7 months of experience under our belts, both in terms of personally dealing with this, right? As, working through this, finding ways to find joy in work and joy in life and connecting with family members and our loved ones through this, but also in terms of, making sure that we're safe through this and making sure that we're preventing spread and preventing infections and preventing that chain of transmission. So, I have a bottom line 3 that I could get into sometime today. But the reality is that we actually have a lot of experience under our belts by now in dealing with this, and we're well armed in Canada, especially in terms of making sure that we have just as kind and courageous of a response ahead of us in the next few months as we did originally when we had to make a lot of changes to our lives in our first wave.
So you recommend the flu shot to your patients? Right.
I do.
Okay. And then what about this, people are waiting for a COVID vaccine. We're not sure if there will be one. We hear, things from the south of us in the US where they're talking about, there will be a flu shot or a COVID shot by the end of the year or in a couple of weeks. There seems to be a lot of conflicting messages that this vaccine will be the thing that fixes us all. So besides getting a flu shot, what are some other things that we can do?
Yeah. And I mean, the flu shot is a big one because it's, like I said, there are a lot of things that are outside of our control in COVID and everything going on in the world right now. And the COVID virus vaccine is one of those things where, we could kind of speculate when it's going to be available, when a safe and effective vaccine is going to be available, maybe sometime in 2021. So we're hoping maybe we might have a few different versions, hopefully, that cross that finish line that are made available to the public. They're kind of probably staged where we have the folks that get very sick from COVID that are prioritized first in our first few releases of it, and then kind of it's dispatched to the broader population through 2021, 2022. But a lot of that is still kind of speculative and really outside of our control because the science is emerging, right? And we're still waiting to respond to that. But there are a lot of things on an individual level that we can control. The flu shot is one of them. But there's also something I talk about that's called what we'd call the physical distancing budget, right? Have you heard of that kind of
No.
phrasing before? Mm-mm. So, I mean, this applies to a family and personal level, but also on a policy level, right? So I'll go into the family and personal level first. So the physical distancing or physical budget that we talk about is basically the concept is this. There are some things that are really important for us all to do. Right, kiddos being in school is one of those things, both for families, for working parents, but also for society, right? So that's a priority. We want to make sure that schools stay open. But for schools to stay open, realistically, given the amount of COVID virus spread we have in our communities, we may have to sacrifice some other stuff. So this makes for choosing and making some very hard choices in terms of the other kind of things that we do in our day-to-day lives, in terms of protecting our families, and then at the end of the day, protecting our communities and shaping kind of how the rest of the epidemic and that second wave goes. So for instance, if a family has kiddos at school, and they also want to see the grandparents for Thanksgiving coming up, for a holiday coming up, they probably have to be much more careful around that. They probably have to see them. Like I said, we know a lot more about the virus now than we did a few months ago. They could still probably see them, but they have to do it in a more careful way. So outdoors better than inside, lots of distance better than within a meter or two. Masks, you've been seeing a lot about masks recently. So masks better than no masks. And these are things that we can control. That make a big difference actually to COVID virus spread, as long as we're all very diligent around it. And then, I mean, the physical distancing budget comes into play at a policy level as well. So as a society, for instance, if we want to keep schools open, it also might mean making some hard choices, unfortunately, in terms of other places where COVID might spread. So bars, indoor restaurants, these kind of things. And it's really hard to make those choices because at the end of the day, those are also oftentimes small businesses and people rely on them to put food on the table. But it is a reality of the pandemic that we have to kind of weigh these trade-offs as a society. And probably that's kind of how we're going to have to start thinking about COVID into the coming year, 2 years, at least until kind of widespread adoption of some kind of a vaccine, kind of a safe and effective vaccine as it rolls out through the populations.
I mean, it's hard to believe that, we've been in this and we've heard about a second wave. Are we in the second wave, or does it vary throughout the country?
Tamara, I mean, I think there are two ways of looking at it, because the question has deep wisdom in that there are different places in Canada that are actually still doing very well with COVID. So I think of the Atlantic bubble, right? They're a fantastic, under-recognized success story in terms of COVID, but that could change very quickly, right? And, for the Atlantic bubble to be safe, Probably it also depends on how well the rest of Canada is doing in COVID. And there are places in Canada that have numbers that are just as bad, if not worse, than the first wave around. So I think to places in the Greater Toronto Area, places in Quebec that are really in what we'd call the red zone in terms of COVID virus spread. And then also in terms of, there's this concept of COVID isn't just a biological entity. It's also very much a social entity, a political entity. It's a racial entity. It perpetuates inequities that are already there in society. It perpetuates, these structural issues that we have, even in Canada, very much deeply rooted in our healthcare system, in our political system, in our social systems. And I'll give the example of Toronto because I know it well. And there are places in Toronto where your risk of getting COVID through the first wave, but now also in the second wave, is 10 times higher than other places just a few kilometers away. So just based on your postal code. And then in terms of getting a COVID virus test, right, there are places in Toronto, like Northern Toronto, I saw the stats on this a few days ago, or Rexdale in Toronto, where if you go in and get a test, usually, if you're getting a COVID virus test, your rates of that test being positive in other places in Canada are less than 1%, right? So 1 out of 100 people that are getting tested are turning up positive. But in these places, in Northern Toronto or in Rexdale, for instance, 1 in 10 people who are getting a test are ending up with COVID. So we find that, the rates are so high.
And why is that? And
I think it comes down to the fact that this isn't just a biological disease. We used to, probably this word has been floated around a lot. We used to think that maybe COVID would be one of those things that's kind of the great equalizer, that everyone is affected, everyone's impacted the same way. But we know that it's the same storm, but everyone has a different boat to get through it.
So, poverty has a lot to do with it too, right?
Exactly.
People who live in poverty, and there are a lot of people living in poverty in Canada. A lot of people with disabilities living in Canada who don't have the same resources. And I guess we can kind of, use, the example of when somebody who is very wealthy might get different care than somebody who isn't. So, because this is a virus that is affecting, different communities in Canada, very different, and it's quite chilling to see at times, when we see what's happening.
And totally, and this is where Canada will really have to focus in terms of addressing the social disparities that we're seeing. So, for instance, older adults, right? 8 out of 10 deaths in Canada. This has been one of our biggest failures as a Canadian society. 8 out of 10 deaths have been in long-term care. We know that older adults, Black communities, Indigenous peoples, working parents, people with disabilities, like you said, people experiencing homelessness, are all very hard hit. And kind of as we fine-tune how we respond to this, we want to make sure that we're thinking, it's not just a virus in the biological sense, it's also the social, political, economic type of disease.
Let's talk about, businesses, workplaces, and COVID-19, because you do work with a lot of businesses. And you, I guess, create models and guide them as to how to navigate this pandemic. So what are some of the things that you advise workplaces on?
Yeah, absolutely. And so the way it works is that near the start of the pandemic, we put together a team of doctors that are advising TELUS and other organizations on how to be kind of science-based and compassionate at the end of the day in their approach towards COVID-19. And the things that we work on are anything to do from bigger picture policies like masking, right? And I'm very proud to say that I like to think that we helped socialize masks for Canadians, and we made a difference in, socializing masks, especially in the corporate sector. And there's a lot of the role of organizations and large Canadian corporations, and setting the stage for what counts as a positive and science-informed and compassionate approach to COVID. So masking is one of our success stories, Then there are other things like, where do we as an organization make the biggest difference for Canadians within our foundation or what we invest in, or how we shift care for Canadians. So for instance, TELUS has a large health portfolio, and the health portfolio supports a lot of family doctors, for instance, and doing virtual care for our patients and our practices. So making sure that we think of both the organizational kind of health and safety viewpoint, how the organization can be a role model for others, and then also how it can make the biggest difference for Canadians, for health systems, for everyone on the ground dealing with COVID.
Do you think that if we should, I'm in British Columbia, you're in Ontario. A lot of times we feel over here that we're kind of in our own situation over here, and that you guys over there never remember us, and nobody thinks about the West Coast. I'm not going to say we did well with COVID, because we did lose a lot of people. A lot of people died. Too many people did. But when I see what's happening in Ontario and Quebec, obviously I'm very concerned about what's happening. But if it gets out of control there, does it affect the rest of the country? Or should I just, not worry about that and just worry about what's happening in my own province, sort of thing?
Yeah. And again, I think there's really deep wisdom to this question, because it's the same analogy that we use for long-term care or other populations who might be at risk of getting very, very sick from the COVID-19 virus. And I think it's the same story between, Ontario and Quebec and the rest of Canada. If Ontario and Quebec get very bad, it does have a big impact on the rest of Canada, and it does make transmission more likely throughout the rest of Canada, because like it or not, there is a lot of movement between the provinces and even within the provinces. So the long-term care analogy we use is, some people say that you could put this kind of iron wall around long-term care to make sure that it's protected. But the reality is that, that's actually really hard to do, because we have healthcare workers going in, we have family members going in, as they should. They're important caregivers to our older adults. The best way to protect people who are at risk, and the best way to protect provinces who are doing well in COVID, whether it's the Atlantic bubble or, British Columbia, after the first wave, they weathered it very well. The best way to do that is to make sure that community spread is low, right? And that's where we're having a lot of difficulty in Ontario and in Quebec, in making sure that, our spread in communities is as low as possible, because as soon as it rises, we start seeing an impact on long-term care. We're already starting to see an increase in hospitalizations, right? And it's kind of a delayed effect, where when you start realizing it, it's it's almost too late to kind of intervene as early as you'd like, right? And that's where hindsight is best. And that's where, it'll be important to see what Ontario and Quebec do for the other provinces as well, for the Atlantic bubble and for British Columbia, because it'll have a big impact on them.
Yeah. Okay. So, as you know, TELUS, is pretty incredible at giving back. And one of the things that we've been trying to do is talk to our guests about something that, somewhere that they support and care about. And we've been donating $500 to the charity of our guest choice. And you chose NamiRes, which is a charity based out of Toronto. Can you just tell me a little bit about them? I've never heard of them.
Absolutely. So I'll back up again. I think we spoke about already how, COVID is not just a biological thing. It's a social, political, economic entity as well. And to solve it and to help address it, we have to think in those frameworks. And NamiRes is what I call, an organization that does, we'd say, our social prescriptions for our community. And by social prescriptions, I mean things that address social needs and economic needs. So in their case, they provide housing and social services to people, Indigenous men in our community. And I see the difference that they make every day in the patients that I care for. But I also was able to spend some time with them, with a colleague of mine who works there. And it was just beautiful seeing the difference that they're able to make within our community as kind of a provider of what we'd call social prescriptions. So these interventions that address social needs And in their case, kind of housing, a sense of community, and then even getting care to folks who really need it.
Wonderful. Okay, well, we're going to donate $500 on your behalf to them.
I appreciate that, Tamara.
Yeah, no, it's great. And listen, the tracing app, this is the app I would have downloaded, right? When the government announced it, I downloaded it right away. I haven't opened it since. Should I be using this? Should Canadians be using this COVID-19 tracing app?
Yeah, and again, this is an easy answer because we're seeing in many parts of Canada that public health is getting overwhelmed. Their public health, our leaders are excellent, but also we're up and coming in the second wave. There's a lot of work to do, and in many cases, we're seeing a system under immense strain. So we're seeing that in Toronto, we're seeing that in Ottawa. We'll probably see it more and more throughout the country. And the reality is that we're seeing announcements from public health that they're not doing as much contact tracing as they'd like to in the pandemic. And this is kind of a quick and easy solution where, despite this idea that public health might be, working very hard but under a lot of pressure, we could contribute in that. It's an anonymous. It's really easy to download. It has the sign off from Canada's Privacy Commissioner, and if someone gets a positive test, they put it into the app. It's Bluetooth based, so it kind of senses who's been around them within the last 14 days, and it lets everyone know to stay safe and to get a test themselves. So it's one of those easy solutions that we can all download and use, and the more people that use it, the more effective it gets. So it's really one of those things that we can do for our communities as well as for ourselves to keep ourselves safe.
Yeah. Okay. Well, that's a good plan. And, so I want to go through, just as we're wrapping up, the important things that we need to remember as we move forward here. We need to get the flu shot.
Yep. The flu shot is one. Mm-hmm.
Yeah. Wear your mask.
Mask is the second one. Yep.
I'm not a doctor. I'm just seeing if I've got this right. And I guess keep your distance, right?
Mm-hmm. Exactly. Yeah. So those are really the three key things. I would add the COVID alert to that too. So those would be my four bottom lines. So flu shot is one. Again, it significantly reduces your risk of getting to the hospital from flu, and it saves really COVID tests, hospital beds for those who are going to really need it most in our upcoming second wave. Masking is a big one as well. So our mask protects others around us and then us as well. It's a great thing to do, especially something that we could control up until that we have the COVID virus vaccine.
Yeah, and I find it really is. And it's funny, Dominic, because there seems to be, or we see these people who are really against wearing a mask, and it's something about their freedom or something. And I personally don't understand it, because it's my gift to you by me wearing a mask. I am protecting you in case in case I've got something. It's the least selfish thing that you could do by putting on a mask and protecting others around you, right? Yeah. That's really what it comes down to, isn't it?
Yeah. And I mean, at the end of the day, there are still people that are against wearing helmets with bicycles, or probably a few people really don't like wearing seatbelts, but it's one of these common sense things that we'll all have to do, especially as we wait for a vaccine. Distancing and the COVID alert app are the third and fourth ones, but those would be the four that I'd be recommending for everyone in Canada, even in communities where we feel they're doing a bit better. But COVID is one of those things that can spark and get out of control very quickly. So that's why being careful, even outside of Toronto and Quebec, and these kind of places that we're identifying as hotspots, is so important.
Well, I really appreciate you taking the time to go through this with us. They're pretty easy asks that you have for all of us. I think that most of us can handle that. So mask, flu shot, the app, and keep yourself distance from others as best you
100%.
can. Yeah. I want to thank you again, and let everybody know that you can follow Dr. Novack on Twitter at Dominic. It's DOMINIK Novick, which is NOWAKMD. And he's on Twitter, and you can find out more information from him there. Dominic, thank you so much. I really appreciate it.
Mara, thank you so much for having me.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.